guys, Lauren and Rebecca here with Bizrok. In this week's video, we want to talk to you about smart scheduling and how you should really stack up your schedule just the right way to ultimately hit whatever your production goals are, right? So Rebecca, will you go ahead and jump into smart scheduling and what that means?
Smart scheduling sounds a little scary. Anytime you talk about altering your schedule, it gets a little bit scary because we all get into routine. So we want to mix it up a little bit. When I think of smart scheduling, I think of scheduling to optimize the schedule, able to get more patients seen that day, but also not feeling like you're working so hard that you leave there exhausted every day.
Well, that's why we call it smart scheduling, because it's really showing you how to work smarter, not harder.
Yes. So with that being said, I do believe that there's a value for chairs. So once you figure out what the value for your chair time is within your practice, so for instance, the average chair value is about $1,200 an hour. So that means that's what you should be producing an hour within each operatory. If you have one doctor and you have two operatories, that makes it so much easier to do. So when you are scheduling, you're going to block off times and have a pre-block schedule already posted. So that way your team knows where the optimal times are to schedule appointments. For instance, if you have a crown prep, then you know that you can probably do another crown seat off to the side the last 30 minutes of your prep. You can also start with an emergency in a seat the beginning of your crown prep. The patient's getting numb. They're getting brought to the back. They're having all their pre and post appointment instructions gone over. So that allows the second assistant to be utilized and the second operatory to be utilized. But when you're doing this, the most important thing to keep in mind is the dentist has two hands.
Yes.
So you need to look all the way across your schedule, not just in the doctor's operatories. You need to see when he's going to be or she's going to be needed for a hygiene check and or a new patient exam, and making sure that we are scheduling accordingly. They can't be in multiple places at once. So that brings us to how important it is to have your morning huddle.
I was thinking the same thing. And I was like, gosh, you know, that's why morning huddles are so important.
So important.
Because docs, that allows you to say, you know what, for these two 9 o'clock patients, I'm going to be really busy or tied up towards the end of that appointment. Yeah. So I'll do the hygiene checks first. It allows them to kind of control their whole day.
It does. So we also need to keep in mind with hygiene, we don't have to wait to the end of the appointment to do a check.
Yes.
For instance, if the patient needs to have an updated probing, they haven't had their probing for the year and or images, take your images, go ahead and probe, and then radio that you're ready and come up with keywords in a practice. For an example, you can use red and green. Red being that I'm ready for a hygiene check, but it's not the end of the appointment. And green being I'm ready for a hygiene check, it's at the end of the appointment, I need you to come now. When we are able to do that during morning huddle, it is wonderful because then the whole team knows where the doctor is going to be when and where during the day. So we know where to locate him or her, but we also know where we can stick your emergencies.
I love that because oftentimes with a lot of the softwares, you can also update the schedule and leverage the software where it has doctor time and assistant time. So you truly know exactly where your doctors are.
Yes.
As long as it is scheduled appropriately.
Yes. So when you're calling out for your next appointment, always let the team up front, whoever you are building authority to see the patient next for checkout, let them know. We always like to use the term, you can say ADA, being 2 units, being 20 minutes for the assistant. D is going to be 4 units, 40 minutes, and then A, an extra 2 units or 3 at the end of the appointment, depending on what appointment it is. So say A2, D4, A2 at the end. It just lets whoever know that is actually going to schedule the next appointment, how to schedule it and where to put assistant time versus doctor time, and where we can put the emergencies in between and or the non-production appointments.
I love that. I think it's just a good cheat sheet for the team. But also, you know, you mentioned earlier about crown appointments and, you know, putting a crown seat towards the end of a crown prep appointment. But I've also seen practices where whenever they start to block schedule, they're very, very rigorous with their block scheduling. And then they get frustrated because they're like, the team's not following it. Well, that's because we're creating a unicorn schedule instead of allowing some sort of flexibility. For example, you know, types of appointments that can be during different blocks. Can you kind of share a little bit about that?
So I always go off of production. When you have something blocked off for a crown and it comes to 2 days before that appointment, always know the average crown you're looking at 1,500 or above. So if it is 2 days prior and we don't have a crown to place there, but we're trying to keep the schedule blocked at a certain amount of production, you can always replace that with a root canal. or 2 different teeth that have larger composites, possibly for half, and then another appointment for another patient that has more composites that are scheduled. Always keeping that number in mind. It doesn't have to stay exactly with what we have scheduled, but we want to keep the production the same. That way we are able to hit all of our goals in the office, and everybody can benefit because we're, again, working smarter and not harder.
Yes, I love that. And for me, that's why that ASAP list is really important, or a quick fill list. You know, everyone calls it something different, but being able to go through that quick fill list and pulling some patients like, okay, well, I don't have any crown prep appointments that want a sooner appointment, but how many composite appointments do I have? Could that get us to our goal?
And it's the same thing if you're in an aesthetics office. If you see Botox patients or any kind of injectables, fillers or Botox, any kind of TMJ therapy or occlusal guard, it's the same thing. It's knowing how much production is going to come from that and where you can schedule it. Also keeping in mind how much time is needed for the doctor versus the assistants, and that we're able to plug and play in those areas. The other thing with smart scheduling is making sure that we have block off areas for emergencies for that day.
Always.
And that always comes to morning huddle as well. Calling off at least 2. Guys, you want to have at least 2 every day. Preset emergency times. If you can do 3, that is an added bonus. After that, I do believe that the clinical team needs to be asked where emergency can go before we just start plugging them into the schedule, because we don't really know what's going on in the back, in the front, and vice versa. Just having respect and knowing where to put a patient where they're not going to have to sit and wait for a long time.
Love that. Last thing when it comes to smart scheduling, Rebecca, will you talk about butting up appointments next to each other so we're not leaving those awkward 30-minute blocks of time where we can't do anything?
So awkward. So when you are scheduling, you want to visualize your schedule. So if you open at 8 and you take lunch at 1, you either want to start scheduling at 8 or you want to schedule at 1 and work your way up, and 8 and work your way down. That way we're not just putting a random appointment in the middle of the day and then leaving that awkward time available. So if we have somebody scheduled at 9 o'clock, then we only have a 1-hour appointment available for above. That really limits us. That is maybe 2 composites. It's too much time for a crown seat, too much time for emergency, but not enough for a crown prep or a root canal. So it really limits you what you can put. So always start at the beginning of your day and before lunch and work your way in, and then after lunch, at the end of your day, and work your way down. That way you're filling in and not patching your appointments.
Yes. Oftentimes, and usually it's for the front office team, they think the patient can see their schedule, and so they start stressing because they're like, oh, well, technically I could fit the patient here, but guys, the patient can't see your schedule. Like, remember, that's why we have to master our language tools and techniques. Guide the patient where you want to go. They will go wherever you tell them to go if you just say it with confidence.
Yes. Utilize your dual close.
Yes.
I cannot stress that enough. Out of all of our tools, that is probably one that really, really, really needs to be role played once a month, once a quarter with the team. So that way we can drive our patients where on the schedule we would like for them to go.
So guys, as always, if you need any help or need guidance on how to figure out the perfect smart schedule, or how you should be blocking off your day appropriately for your practice, because every practice and every doctor is totally different, then reach out to us. Send us an email, info@bizrok.com. We'd be more than happy to help you and guide you in setting that up for your practice. But as always, guys, we can't wait to see you again and serve you soon.